Step is we're going to do the Fraxel repair by Medical, in which the fractionated CO2 laser is going to allow for a complete resurfacing of the epithelium and stimulating the dermis, so it's regenerated by improving the skin texture, tone, fine lines and wrinkles, and also getting some of those deeper pigmentation changes that the IPL was unable to get. So we're going to do that, and what she may feel during this procedure is a little heat, and that's why we added topicals to begin with and gave her some of the local anesthetic from the underlying filler substances to try to make this a little more comfortable for her. The nice part about fractionated CO2 is the fact that it leaves energy that comes in microbes that go down into the dermis, stimulates it, but leaves some of the normal tissue, so allows the regeneration to be much quicker. The old CO2 was 100% ablative, where all the tissue is completely removed and took about 12 to 14 days of resurfacing to occur. This all resurfacing is almost going to be completely done within the next day or two. So that's what makes it excellent short-term downtime and recovery to be able to be having makeup and such applied within a 3 to 5 day period. Hydrating mask on by Epionce. It's one of the medical grade components of skincare that we use for her recovery. This is part of the healing component to making sure we have a semi-occlusive membrane over top of it, allowing for complete resurfacing without minimizing healing, but also promoting the reduction of redness and inflammation to get a smooth resurfacing to occur.
So what are you doing?
We're just using a chiller or cool air to just kind of cool the tissues and make it a little more comfortable to dissipate the heat that the skin is received from the laser. And this is the hydrating mask that we're placing to help facilitate resurfacing of the tissues. It cools the tissues, allows the tissues to resurface with minimal inflammation and reduction of the redness.